everyone. If you're deep in prep for your parasitology exams, you know there are certain parasites you've just got to know inside and out. Today, we're tackling a big one, Trichuriasis, or as you probably know it, the whipworm infection. So let's just dive right in. So, to get our brains warmed up, think about this. What parasite gets its name from that classic whip-like shape? The name itself is a huge giveaway, and it's a key detail you'll want to remember. The answer, of course, is Trichuris trichiura, the whipworm. And over the next few minutes, we're going to master everything you need to know about it. Okay, here's our game plan. First, we'll meet the culprit. Then, we'll follow its life journey. After that, we'll decode the clinical clues it leaves behind, nail the diagnosis, and finally cover treatment and a super fast final revision. Everything you need for your exams, right here. All right, section 1. Let's get properly introduced to our little troublemaker. What exactly is the whipworm, and why is it so good at causing problems? So, what are we talking about here? In a nutshell, Trichuriasis is an intestinal infection caused by a roundworm, a nematode, called Trichuris trichiura. And here's a key phrase to remember. It is a soil-transmitted helminth. That tells you a ton about how people get infected, just like its cousins, Ascaris and hookworm. And why should you care? Well, look at that number. This isn't some rare, exotic parasite. We're talking about an estimated 604 million infections around the globe. It really loves warm, moist climates, and unfortunately, it disproportionately affects kids, making it a massive public health issue you need to be aware of. Okay, now this slide is pure gold for your exams. You have to know these two forms. On the left, in A, that's your diagnostic stage, the classic barrel-shaped egg. And on the right, in B, you've got the adult worm. See that long, skinny front part? That's what gives it the whip name. Unmistakable. So, we know what it looks like. Now let's trace its journey from the environment into a human host. Section 2 is all about the life cycle and pathogenesis. This is super high yield for exams, so pay close attention. Here's the 30,000-foot view of the life cycle. And the first thing you should notice is that humans are the only host. No intermediate hosts, no complex steps. That simplifies things a lot. The entire drama unfolds between humans and contaminated soil. Now, to lock this cycle in your memory, we're going to use a really simple mnemonic, IHAE. First up, I is for ingestion. You swallow the infective embryonidated egg. H is for hatch. The egg hatches in the small intestine. A is for adult. The little larva moves to the large intestine and grows up. And finally, E is for eggs. The adult female lays unembryonated eggs which get passed in the feces. And remember, the infective egg is embryonidated, but the unembryonated egg is what you diagnose. So, how does this actually make a person sick? Well, it's a two-pronged attack. First, the adult worm uses that thin, whip-like front end to literally thread itself into the lining of the large intestine. This causes direct physical damage and inflammation. And on top of that, the body kicks off an allergic response to this invader, which just makes everything worse. Okay, so that's what's happening on the inside. But what does this look like in a patient? What are the classic signs and symptoms that should make you think whipworm? Let's get into the clinical clues. For the clinical features, you're going to want to remember this mnemonic. A-DARM. A is for abdominal pain and anorexia. D is for dysentery, specifically something called Trichuris dysentery syndrome, which gives you that awful bloody mucoidal diarrhea. The next A is for anemia, a result of chronic blood loss. R is for rectal prolapse. This is a huge red flag, especially in heavy infections. And finally, M is for malnutrition and growth retardation in kids. Commit A-DARM to memory. It'll really help you on exam day.
So you see a patient with those symptoms and you're thinking it could be trichuriasis, but you need proof, right? How do you actually confirm it? That brings us to the lab.
And the good news here is that the gold standard is pretty straightforward, a stool examination. The female worm lays a ton of eggs, so a single stool sample from a patient with symptoms is usually all you need to spot those classic eggs. And this is exactly what you're looking for under the microscope. This is a classic spotter for your practical exams, so really burn this image into your brain. You have to remember these three key features. 1, it's barrel-shaped. 2, it's bile-stained, giving it that brownish-yellow color. And 3, look at those distinctive clear plugs at each end. We call those polar mucus plugs. You see this, you've got your diagnosis. Now, besides finding the egg, what else might you see? Well, a blood test might show peripheral eosinophilia, usually under 15%, and you'll likely see a raised serum IgE level, which just screams parasitic infection. And in some rare heavy infections, you might even see the adult worms themselves during a proctoscopy. All right, you've confirmed the diagnosis. What's next? Time to talk treatment and prevention. Let's cover those in our final section, and then we'll do a rapid-fire revision to tie it all together. Okay, for treatment, your go-to drugs are albendazole and mebendazole. The main thing to know is that they both work really well, giving you a 70 to 90% cure rate. Albendazole is usually a 3-day course, while mebendazole can be just a single dose. Ivermectin is an option, but honestly, it's not as effective against whipworm. So how do we stop this from happening in the first place? Well, since it's a soil-transmitted bug spread by the fecal-oral route, it all comes down to sanitation and hygiene.
We're talking about things like better personal hygiene, hand washing is huge, properly disposing of human feces so it doesn't contaminate the soil, and improving nutrition, especially getting enough iron to fight off that anemia.
All right, this is it, your quick revision, last-minute cram slide. If you remember nothing else, remember this. The agent, Trichuris trichiura. How's it transmitted? You ingest the embryonated egg. Key symptoms? Think Trichuris dysentery syndrome and rectal prolapse. The diagnosis? That classic barrel-shaped egg with polar plugs in the stool. And the treatment? Albendazole or mebendazole. That's the whole story in a nutshell. And to wrap this all up, I'll leave you with a question to think about. Since whipworm hangs out in the same places and spreads the same way as other parasites like ascaris and hookworm, patients are often infected with more than one at a time. So how might that change the symptoms, the diagnosis, or even your treatment plan? Something to chew on for a deeper level of understanding. All right, that's it for whipworm. Good luck with your studying.